Welcome to the Deep Dive. We take complex information, distill it, and give you the key insights. Today we're digging into something really urgent. The HIV crisis escalating incredibly fast in the Philippines. And when we say escalating, I mean the numbers our sources flag are kind of explosive. What did you find on the sheer scale, say, from 2010 up to now?
Right. It's crucial to understand the gravity here. While global HIV rates have mostly slowed down, the Philippines is actually facing the fastest growing epidemic in the Asia Pacific. It's quite shocking.
Fastest growing.
Yeah. Our sources show a staggering 550% surge in new HIV cases between 2010 and 2024.
550%.
Exactly. Think about it. That means about 57 Filipinos diagnosed every single day.
Wow.
And the trend seems to be worsening. Just in the first quarter of 2025, over 5,100 new cases were reported. That's a 50% jump from the previous year.
50% in just 1 year.
Yes. And if this isn't checked, the projections are grim. We're looking at maybe 252,800 Filipinos living with HIV now in 2025, but that could swell to 400,000, maybe even 500,000 by 2030.
Those numbers are, well, they're a real wake-up call. And what's particularly tough reading through this is who's being hit hardest. The sources point to a very specific group.
Precisely, and that's the real tragedy here. It's hitting the youth incredibly hard. People aged 15 to 24, they account for a shocking 1/3 of all new diagnoses.
1/3, just that age group.
Yes, and some reports even suggest a 500% increase specifically for them.
500% for teenagers and young adults.
It's deeply concerning. And what's really heartbreaking, honestly, is a detail from 2025, a 12-year-old diagnosed through sexual contact. Yeah. It forces you to ask, what specific factors are putting young people, kids really, at such extreme risk.
That's devastating. A child that young.
Yeah.
Already caught in this statistic. Yeah. And that's exactly what we need to unpack, right? So if we focus on this concentration among young people, what makes them so vulnerable, our sources mention that youth aged 15 to 34 make up almost 80% of new cases now. That's huge.
Yeah, it is. It's a massive demographic shift in the epidemic.
So what's driving that? What are the forces putting them right on the front lines?
Well, it's not just the high-risk behaviors themselves, though those are definitely there. It's also this underlying systemic silence around it all.
Systemic silence.
Yeah. Like that 2021 study you mentioned, only 13% of young men using condoms during paid sex. That's not just a number, right? It points to a failure in empowering them to, insist on safety.
Even when their health is clearly on the line.
Exactly. And health officials point to risky sexual behavior, sure, amplified by easy access to online porn, dating apps, all that.
Okay.
But it suggests something deeper, too, a real societal discomfort talking about sexual health that goes way beyond just, it's the apps.
So it's not just about what people are doing, but what they know. Or maybe, more importantly, what they don't know. This stat that only 20% of youth have comprehensive HIV knowledge. That seems incredibly low. Is it just bad information, or are there bigger reasons for these knowledge gaps? Like, is it the schools?
Yeah.
Or something else?
That's really the core of it. The data, like that 2022 study, only 36% of men who have sex with men, MSM, could answer basic HIV questions right.
Only 36%.
And it was even lower for the younger ones, 15 to 17. It shows information isn't just lacking, it's not getting through effectively.
So misinformation just fills that gap.
Pretty much, especially online, social media, when you have 45% of young people believing that pulling out reduces HIV risk.
45%.
Yeah. It shows a fundamental breakdown in trust and reliable information. Public health isn't just teaching, it's fighting against these really ingrained myths that directly harm prevention efforts.
And it feels like these gaps in knowledge are made worse by, a cultural thing. What about stigma? Silence. How does that play into it?
Oh, it plays a huge role. Massive. Insidious, really. There's this cultural shame around HIV, around sexual health generally, that just shuts down open conversation.
So people are afraid to even talk about it.
Absolutely. It's not just feeling awkward. It's a real fear of being judged by society, family, even healthcare workers. And that fear directly stops people from getting tested, from seeking prevention.
Wow. That's powerful.
The impact is clear. Over 75% of young MSM have never been tested, largely because they fear discrimination.
75%?
Yeah.
Never tested.
Yeah. So you connect the dots. Stigma is this massive wall keeping people away from life-saving information and services.
That really does sound like a systemic breakdown, doesn't it? We've covered individual choices, knowledge gaps, but it feels like there's something bigger pushing this crisis forward, something beyond just personal responsibility. What are those larger issues, the systemic failures?
You've hit a key point. There are significant legal restrictions acting as barriers. For example, minors under 18. They still generally need parental consent for condoms or even HIV testing.
Still, even with this crisis.
Well, the 2018 HIV/AIDS Policy Act did lower the testing consent age to 15, which was a step. But practically speaking, getting condoms still restricted for many young people.
So that's an immediate block to prevention and finding out early if someone's infected, especially if they can't or won't involve their parents.
Exactly. It's a major hurdle.
Okay, so there are legal barriers. What about education? The sources suggest a real lack of comprehensive sex ed in schools, despite the obvious need. Is that about money, or is it more resistance? Cultural, political?
It seems to be a complex mix based on the sources. Many schools just don't offer the kind of comprehensive, age-appropriate sex education that's, frankly, desperately needed.
You have data on that.
Yeah, a 2018 study found only 66% of women aged 15-49 even knew condoms prevent HIV.
Only 2/3 knew that basic fact.
And data from 2021 in central Luzon was even starker. Just under 20% of youth there had accurate HIV knowledge.
Wow, 19%.
On top of that, you have persistent resistance from some religious and cultural groups. That's consistently delayed effective evidence-based programs. So it's not just funding, it's a deeper reluctance to tackle sexual health directly.
And speaking of funding, it sounds like prevention is really under-resourced. Our sources said in 2023, only 6% of the HIV budget went to prevention. 6% seems tiny for a growing epidemic.
It is incredibly small, and the situation's made worse by recent pauses in international funding, like from the U.S.
Yeah.
That directly threatens community-led efforts, the groups actually on the ground doing the work.
So prevention efforts are essentially starved.
It certainly seems that way, and when that happens, the whole system becomes reactive, trying to treat cases rather than proactive, stopping them before they start.
So, okay, let's put all these pieces together. The behaviors, the knowledge gaps, the stigma, legal hurdles, education issues, underfunding. What's the human cost? What does this mean for individuals and for the Philippines as a whole?
Well, the individual toll is immense. Obviously, there's the medical side, and HIV diagnosis means lifelong antiretroviral therapy, RT. These meds are effective, they suppress the virus, let people live long lives, prevent transmission.
Which is great, medically speaking.
Absolutely. But beyond the pills, there's often huge psychological strain. Social isolation, that stigma we talked about, it leads to real discrimination at school, at work.
So it hits their mental health, their social life, their finances.
Yes, it compounds the emotional pain, adds financial burdens. It creates this cycle of vulnerability that's hard to break.
And beyond the individual, the healthcare system itself must be under incredible strain with this surge, right?
Completely overwhelmed. You have limited doctors, nurses, struggling to keep up, provide consistent care. And if you look at the UNAIDS 95-95-95 goals.
Remind us what those are.
Right, the global targets. 95% of people with HIV know their status, 95% of those diagnosed are on RT, and 95% of those on ART have their virus suppressed, meaning they can't transmit it.
Okay, 95, 95, 95. How's the Philippines doing?
Alarmingly far behind. Currently, maybe only 55% of Filipinos with HIV know their status. First, 95, way off.
Only about half know.
Roughly. Then, of those diagnosed, only about 66% are on RT. Second, 95, also missed. And of those on treatment, only around 40% have achieved viral suppression. The last, 95. Not even close.
Wow. So 55, 66, 40, that's nowhere near 95, 95, 95.
Not at all. And you can see how that puts immense strain on the whole healthcare system, let alone failing to control the epidemic effectively.
And zooming out even further, the societal impact beyond healthcare. What does this mean for the country's future?
It's deeply concerning. A whole generation battling HIV doesn't just strain public health. It impacts economic productivity, right?
Makes sense.
The costs of lifelong care, related health issues. It's a burden on families, communities, the national budget. It really threatens the nation's future, especially since it's the youth, their future workforce, their future leaders who are at the center of this.
The picture is definitely dire, no doubt about that. But the sources do suggest there's hope. That urgent collective action could turn this around. What does that path forward look like? What's being done and what more needs to happen?
Yeah, there are some important efforts underway. The Department of Health, DOH, the Department of Education, DepEd, they are trying to align school curricula better to address these youth HIV spikes.
That's something.
And you're seeing some youth-led awareness programs emerging, which is always promising. Peer-to-peer stuff can be really effective.
But it sounds like much more is needed.
Absolutely. The path forward really needs concerted action on several fronts.
Okay, so what are those critical actions? What could really move the needle here?
First, removing those legal barriers we talked about. That means reforming law so minors can access condoms and confidential HIV testing without needing parental consent, prioritizing health.
Makes sense. What else?
Second, comprehensive sex education. It just has to happen. Nationwide, medically accurate programs covering transmission, prevention condoms, and pre-EP.
Pre-EP being the preventative pill.
Exactly. Pre-exposure prophylaxis, a daily pill that's highly effective at preventing HIV infection for those at risk. Education needs to cover testing, too. And critically, countering misinformation, maybe using those peer-led programs.
Okay, legal reform, better sex ed. What's third?
Fighting stigma. That requires widespread campaigns promoting compassion, understanding, creating safe spaces, actual places or online communities where young people can seek help without feeling judgment.
Right, tackling that culture of silence.
Precisely. Fourth, funding. There's just no way around it. Local investment in prevention needs a serious boost. Reduce that reliance on international aid, which can be unreliable, and make these programs sustainable.
More local money for prevention.
Yeah.
Got it. And
Finally, youth-friendly services. Making sure testing, counseling, condoms, pre-P, all of it is accessible, affordable, and non-judgmental. Tailored specifically for young people's needs and realities.
it sounds like a comprehensive approach is needed, hitting all those points we discussed earlier. This clearly isn't something that can be solved by just one group. It demands everyone's involvement. So, thinking about our listener, what can you do about this? How can we each contribute?
That's a great question because individual action really does matter here. There are concrete things you can do. First, speak up. Share accurate information about HIV. Talk about it with friends, family, online. Help break that silence that lets stigma thrive.
Use your voice?
Exactly. Second, educate yourself and others. Seek out reliable sources, health departments, reputable NGOs, and gently correct myths or misinformation when you hear it. Knowledge is protection.
Be informed, share facts.
Third, support organizations doing the work. If you can, donate time or resources to groups providing testing, treatment, education, support services right there on the ground.
Help the helpers.
Right. And finally, advocate. Use your voice to demand change. Push for comprehensive sex education in schools. Call for those legal reforms to protect young people's access to services. Insist on increased funding for prevention.
So advocate for the systemic changes.
Yes. Your voice, collectively, can push policymakers and leaders to act. It really does matter.
Okay. So this deep dive has laid bare a pretty shocking reality. The Philippines' HIV crisis, that 550% surge, a third of new cases in the 15 to 24 group. It's a preventable tragedy. It's devastating young lives and truly putting the nation's future at risk.
Yeah, we've seen how these legal barriers, the gaps in education, the pervasive stigma, and chronic underfunding are all interconnected, fueling this epidemic. But as we also discussed, the tools are there. Comprehensive education works, accessible services work, collective action works. We know what needs to be done.
So here's a final thought for you to consider. If the youth truly are a nation's future, and this crisis is, as we've heard, largely preventable, what responsibility do we all share? What responsibility do we have to make sure that future isn't just hoped for, but actively protected? Protected through knowledge, through access, and through compassion. Thank you for joining us for this deep dive.